Okay, let's start our webinar today. And the topic of today's webinar is how to enhance English skills and advice on the common mistakes to avoid in OET exam. So I think this topic is quite interesting because we have designed this topic aside from our routine topics like OET writing, OET speaking, OET reading. So all the webinars we have conducted in the previous months, like the tips and tricks for tackling reading. So I think all of you are prepared enough for these kind of webinars. But today, the webinar is for those students who are planning to take OET like in 2 to 3 months, because some of the students have queries like that, ma'am, I'm not sufficient enough in English. I can't speak English well. So what should I do so that I may fluently speak English in my exam? So let me tell you, OET is not like that yet, that you will be assessed only for speaking English. It is a whole English language test, which is composed of listening, reading, writing, and speaking English. Okay, I'm going to share my screen with all of you. If you are able to see it, please comment yes in the comment box. So can you see my screen?
Yes, ma'am, we can see your screen.
Okay, that's wonderful. Thank you. So I have told you the webinar topic, that how to enhance your English skills and advice on the common mistakes to avoid in OET. Okay, let's start our webinar. First of all, I will give you review of whole of the OET exam. So occupational English test conducted twice a month by Cambridge Box Hill, Australia. As you all know that exam fee is 587 Australian dollar. English language test for a number of professions like doctors, nurses, dentists, pharmacists, and optometrists. So it is basically exam of entry to English speaking countries for doing job there. And it is comprised of 4 modules. I have told you, and you all know it very well, that these are listening, reading, writing, and speaking. So there are some pre-booking exam tips. Categories of students according to the English competence. Okay. So there are 3 things like understanding, fluency, which is speaking, and the other one is writing. So both reading and listening comes under understanding. Fluency is for speaking, and the writing is whatever you write, how you can write in English. It is just the same thing. Everyone has different level of English competence. If you think you are too weak, then before booking your exam, do these things. And what are these things? Here are some tips for listening. For listening, you can try listening podcasts, documentaries, English news channels, and the most exciting is favorite seasons on Netflix, IMDb, etc. Okay, as per the podcast, most of students ask that, ma'am, from where we can find these podcasts, and which podcasts are better to listen. So while searching on YouTube and Google, you can search for medical podcast. Okay, and you will find number of topics on that, like you will be having diabetic podcast, you will be having amputation podcast. And these podcasts are very necessary to listen, because there are number of accents for these podcasts, and you have to be familiar with all the accents, because in OET exam, as for listening portion, you never know, you never have an idea that which English accent will come in your exam. So this point of view regarding podcast and documentaries, English news channels, these all are way to enhance your listening skills. Okay. And for reading, it is try giving a read to medical and health journals of NHS, which is UK health system, HEC, which is Ireland health system, American and Australian health system. Okay, taking excerpts of medical science from newspaper and understanding gist of these. This is very important. If you are going to book your exam and you think that you are not capable enough to understand English. So for reading point of view, you can took out some topics of medical interest from those newspapers, from any journal, medical journal especially. So first read that expert, and then you will have to understand that what is the main crux of this, what is the gist of this paragraph. Okay, in this way you will understand reading module. Now come to writing. For writing, whenever you find excerpt, then try to write it in simple and concise way. Okay, this is the tip of OET writing exam, that your writing part, your letter writing is simple and concise. I have seen a number of students who used to write very fancy words, like fancy English in OET exam. So it is not like that, that you will be marked upon that fancy English. If your English is simple and it is concise, your letter is concise, you will surely score above 400. If there is no other mistake like grammatical mistake, and your format of letter is wonderful, then surely it will be above 400. So there is no need to write some idiomatic English, fancy words to impress the examiner. So it is all in vain. It has no benefit for you. Okay, so please be simple and be concise in your OET writing. As I've told you, it is a tip for acing writing. And make sets of all 4 kinds of letter and try writing these and get them evaluated by mentor. This is a very, very helpful point here. You should be familiar with the number of letters, like kind of letters. As we all know that there are 4 kinds of letter. These are referral, these are urgent referral, discharge, and transfer. So first, what you have to make is to set all the 4 kind of letters and then try writing these. Never do this that you will only try the one letter which is urgent referral or referral, and you say that I am now prepared well in OET writing. It is not like that. You have to try all the letters for preparing your writing part. So next is, without mentor's evaluation, your writing letter writing is literally a waste. Yes, this is true. If you think that you will if one student writes number of letters, like he or she writes 15 to 20 letters, but without proper evaluation and proper guidance, he may never know that what is his mistake in the letter, on which part of the letter he is lacking, where he lacks his marks. So without mentor's evaluation, your letter is literally a waste. There is no need to write like that. First, if you think that you are very good in letter writing, you should write. I'm not saying that you shouldn't try even without a mentor, but the tip is you should write for your own by your own first, and then get it evaluated by the mentor, so that you may be aware of your mistakes. So next is for speaking. If you are not fluent in English, then try speaking in English with your friends, colleagues, or even family members, just to be fluent enough. If you have booked your exam like 1.5 months before the real exam, and you think that you are not fluent in English, then you should try to speak in English in your everyday routine with your friends and colleagues at the workplace, or even your family members. I think this practice will make you fluent in the English. First, book yourself to get assessed by mentor, and then have your speaking partner till your exam for practice. This is an other important point for speaking module. You should get yourself booked with a mentor, and you should take like 3 to 4 module mock test with a mentor, And then you have, if you think and your mentor thinks that you are very well prepared in the speaking module, then till exam, what your practice should be is you should have a routine day speaking partner with you. You can easily find one if you are adding in any group like WhatsApp group, Facebook group. There are a number of groups for OET exam. So if you think that you can easily find a partner with the same date of your exam, and you both can practice till exam. This will be very helping for you. Sorry. Yeah. Okay. In OET speaking, along with competency in English, your empathy towards patient is also assessed. Okay, this is very important point, because most of the students don't think that empathy is very important. I have conducted a number of mocks with my students, speaking mocks actually. And what was the thing they were lacking in speaking module was their lack of empathy towards their patients. They used to speak the whole role play, and they were panicking like time is going to pass very early, and they were not involving the patient, because I was patient in the role play, and they were not involving me. They were the only one who were continue speaking, and they were not showing any empathy towards the patient, what actually patient needs. So this point is very important. You should show empathy towards your patient in speaking role play. So you have to involve your patient as well. If you think that there are no points written for the patient, and then you can ask by your own. Okay, you can say some sentences like, am I clear to you? Am I understandable to you? These phrases will help your patient in trusting you. So basically in OET speaking, empathy is very important, and you will be assessed for the English along with empathy. It is not only English, it is English plus empathy in OET speaking. So always be empathetic towards your patient. Okay, now come to the mistakes, which is our topic as well today. So common mistakes in OET. Here are some common mistakes which candidates do in OET. And what are these? These are first book their exam, and then after wasting all time go for 3 to 4 days crash course with skyrocketing price of courses from any other person academy without verifying authentication. So this is a problem with a number of students, because they really don't know the timeline for their preparation of the OET, and they think that it is just a very simple exam, and it is just an English language exam. So I can really ace it, and they used to book their exam as all of their other friends do. And when they think that no time has left, they try to find for any emergency courses like crash courses for 3 to 4 days for to ace in OET. And what they do is they never verify the authenticity of any academy, any person, and they used to give all their money to them because they want to ace their OET in a first go. So never do that. Always book your exam when you think that you are prepared enough. Not like this, that first you book your exam and then after wasting all the time you go for any crash course. It is not advisable. Okay. Other thing is, please never do this. You should book yourself first for a proper 1 month or 3 weeks course from any recognized platform, and then book your exam. Meanwhile, take mocks to check your preparation. This is very important. If you have prepared well, and you think that you will perform very good in the exam, it is advisable to take mocks from any recognized platform. Okay, it's totally up to you, but mock exam help you really a lot. So some students at the last moment, when not prepared enough, think to withdraw, but to be honest, you get only 30 to 40% of the amount you submit to book your exam. So if you think that you can refund your money by cancellation of exam, you will only get the amount I mentioned. So I have seen a number of students at the last moment who used to say that I'm going to cancel my exam, and I will be refunded with the fee I submitted. So to be very honest, in reality, it is not like that. You will get only 30 to 40% of the amount. I have told you the OET fee, which is 587 Australian dollar, and you will only given 30 to 40% because there are cancellation charges as well. So it is not advisable that at the last moment you go for cancellation of your exam. If you are not well prepared, do not book it. First, get yourself registered with any course, with any preparation material. Like if you are doing by yourself, then it's good. If you want any academy, any mentor, then it is also advisable. But please don't do that, that at the day of exam and before exam you are going to cancel your exam. Okay, attempting OET without proper guidance and preparation is the biggest mistake one can do. Some students appear in exam without preparation, thinking this is just a simple language test, but in reality, it is opposite. Whether you are very good in English, there are chances to fail without proper guidance. I have told you that most of the students think that it is a very easy exam, as most of us actually know how to speak English and how to write English. So they take it very easy, but in reality, it is not that. You have to prepare well for this exam, and I have advised my students for all the modules that for listening and reading, you have to take at least 25 to 30 practice tests before appearing in real exam. As per writing, there should 15 to 20 letters written by you and assessed by any senior, any mentor. And for speaking, you have to practice nearly 5 to 8 speaking role plays. Then you will be able to perform really well in the real exam. Okay, next is all the four modules should be given equal importance because you have to pass the exam in a single sit. No clubbing is allowed for OET medicine. Okay, this is very important point, and there are a lot of queries regarding clubbing. I don't know whether you guys know clubbing or not. Let me tell you, clubbing is the thing like we can, if a student fails in listening module or even in writing module, but two other subsets are passed, like reading and speaking are of the grade which was desired. So if he thinks that he will sit again, and if he clears listening and writing in that subtest and his reading fails in the second one, so he can't combine his results to show to the country in which he is applying. So for basically OET medicine, for doctors, clubbing is not allowed up till now in OET. So you should given all your importance to all the four modules. It is not like that you have to practice listening and reading only, and you will perform well in writing and speaking without preparation. So all of the four modules are very important to practice. Here are some pro tips, and I have mentioned them as earlier. These are prior to practice 20 to 25 tests of both listening and reading subtest, practice 15 letters of writing subtest, and practice 5 to 8 speaking role plays. This is all overall review of OET exam because sometimes a lot of students really don't know about the exam format, that what is the weightage of questions, and which module carries how many marks. So here's a journal review of the exam. Listening subtest is for 45 minutes and it is the first module in your exam. It is consistent of three parts, which are A, B, and C. So part A has 24 questions and it is the most easiest one. Okay, look, if you want to score B grade in listening, you should try to get all 24 corrected in part A. It is a tip. So please keep practicing for part A and try to make sure that you have secured all the 24 marks in it, because it is the most easiest one and it is the most top scoring section. Now proceed to part B, which has 6 extracts. So it is also easy, but not as same level that of part A. So in this part, we can also score good. So now part C, which is having 2 extracts of 6 questions each. This is the most difficult one in listening, and most of the students fail listening due to this subtest. Because part C is very lengthy extract, and you have to, there were 4 options of each question, and speaker is continuously speaking in a flow, and most of the students got confused in part C, and this is the main reason of their failure in part C. So I advise all of my students to score well in part A and part B, which is the easiest one, and you can score grade B in your listening. So now come to reading part, which is of 1 hour 60 minutes, and there are 3 parts as well, just like listening module. So part A is consistent of 20 question, and you will be given time of 15 minutes, and this is separate time for the part A, because after 15 minutes invigilation team will collect your sheets for part A, and you will not be allowed to write something else in your on your answer sheet after that 15 minutes. So another 45 minutes will be given for you only for part B and part C. So you should be very sharp enough in part A, and try to solve it in 12 to 13 minutes, which basically requires practice. As we all know that practice makes a man perfect. So please try to secure all the 20 marks in part A. Now come forward to part B, which is having 6 extracts. It is also the easy one. And part C, just like listening, it is problematic in OET reading. And most of the students lose their marks in this part. So I advise my student to please concentrate more on part A and B of listening and reading, so that you may have margin to lose your marks in part C. Now come to writing. We know that writing is having 45 minutes, and 30 minutes will be given for understanding of the case notes, and then 40 minutes will be given to you for the letter writing, and you have only one letter to write, and comprehension of case notes with a word count range of 180 to 200. Okay, this is all about writing. And letter writing basically is further consistent of 4 types of letter. I have elaborated you that these are referral letter, urgent referral, discharge, and transfer letter. So we may never know that what kind of letter will be given to us for writing. So you should be very competent enough in OET writing as well, just like listening and reading. Now come forward to speaking. Speaking role play will be completed in 10 minutes. You will be given 2 role plays of 5 minutes each. And just after that, you will be given a wait of 2 to 3 weeks for the result of OET. Okay, now very interesting section of our today's webinar. If you guys have any question, you can ask.
Thank you so much for very informative lecture. May I know the fee structure from your side?
Yes, sure, you can. Please, I'm going to mention my course coordinator. She will. Please, can you tell me your name?
My name is Kamal.
Okay, Kamal. Please comment your query in the comment box. I am going to contact my course coordinator. Her name is Ramesh, and she will give you all the details of the fee structure. And this is our course. You can see it from the slide, and its duration is 1 month. You can choose any which suits you the best. There are live sessions, there's practice material, there are add-ons as well, but it is totally up to you, whichever course you want to take. Okay.
No, sorry, I didn't understand. In 1 month course, I'm getting information about all the 4 parts.
Yes, in 1 month course, you will be covered for all the 4 modules. It is not like that you will be given only for writing or only for speaking. Your 4 modules all will be covered in our 1 month course.
Okay, thank you.
Welcome.
Hi, thanks, Doctor, for
Hello.
your presentation. Hello.
Thank you.
Thanks, Doctor, for this very nice presentation. And I want to ask you about if there is any program that is we can improve my listening from Google Play.
Yes. Tell me your good name, please.
My name is Iman, Dr. Iman.
Okay, Dr. Iman, I have told you that you can improve your listening by listening podcast, documentaries, any English news channel. These all will help you in enhancing your skills in OET listening. As per all of these listening podcasts are very helpful. You can easily find them on YouTube, and you can easily find by searching on Google.
Excuse me, ma'am. I have one question. As the recordings are available throughout the
Thanks,
course,
Doctor.
or after that also available? After course was done, also available?
Sorry. Please repeat your question.
My question is the recordings of live sessions available only during course or after the course also?
Okay. Your name, please.
Rani.
Okay, Rani. Okay, let me tell you, when you have done with your payment, you will have all the right of that course material. You will have all the access to that material. So if there is not any recording, if you request for the live session, you can be available with that.
No, if the record, I am already enrolled in this course. I am student. My question is the recordings available of the course was done? Like
Yes,
January
yes.
7th.
Yes, I'm going to tell you that for the course student, there are recordings as well. If you think that you are missing any part of our course, you will be given recording for that. Don't worry.
Thank you, ma'am.
Okay, welcome. Okay, now you can see on my screen that there is OET Assessment Plan by MedExam. So we have divided it into 3 levels. For level 1, these are for those who haven't started preparing yet. And level 1, what are further subdivision in it? It is like 8 letters writing assessment, 10 reading mocks, 10 listening mocks, one-on-one free speaking mock. It is for those who haven't started preparing yet. And for those who have 50-50 preparation, they are categorized under level 2. And in level 2, there are 5 letter writing assessment, 5 reading mocks, 5 listening mocks, and 1 free speaking mock. Okay. And for level 3, it is for those who just need a final revision. Like a lot of students come to us only to take mock with us, and it's level 3. It is usually 3 letter writing assessment, 3 reading mocks, 3 listening mocks, and 1 speaking mock. So is there still any question you can ask?
One more question. Before joining the course, is it possible I can attend any your ongoing course to see I'm comfortable with that?
Your name, please.
Same, Kamal.
Sorry.
Again, I'm Kamal.
Sorry. Okay, Dr. Kamal. Unfortunately, it is not possible that you can have glimpse of our course, but you can take mock for your assurance that what will be our course. You can take mock with us. Either it is writing, either it is listening, or speaking mock. Then you can decide if you want to take a course or not. Okay, any other question? Okay, those students who are asking for course details and all the other queries related to course, you are seeing the number on this, that is WhatsApp number. It's plus triple 447360260668. You can contact on this number as well for getting yourself registered in our OET course.
So when we are supposed to start the course, upcoming new course?
It's first week of January.
Okay, once again, thank you so much.
You're welcome. So any other questions, students?
Did you find any difference in the paper-based and computer-based?
Your good name, please.
Only I'm talking, Kamal.
Okay, Dr. Kamal. The only difference, you should have to check for the countries you are applying for, because there are proper guidelines for every medical council, or every you can say that every country has its own rule. So you have to check with that, that either paper based or computer based, which one is accepted.
Can you guide me regarding the GMC? I think they are accepting both.
As per GMC, yes, I know they are accepting both.
What is
Any other question? Okay, now I'm seeing chat in the comment box, and there is a student, Tokir Hussain. Ma'am, in part A, accent to get is sometimes difficult. Yes, Tokir, it is difficult, but I have advised you all the tricks, that how you can enhance your listening skills. So please try to get all the 24 corrected in part A and all the 6 corrected in part B. Uh, Inshallah, you will score well in listening by this. And other question is, kindly give us tips for reading and listening. And the student name is Fatma Zara. Yes, Fatma, sure. We will soon arrange webinar on these modules as well. And I think 2 weeks ago, Dr. Umair has conducted a webinar on OET writing. And in the last week of November, I have also conducted a webinar on OET reading. So you can also search for them from our YouTube channel. And in future, we will also arrange webinars like these. Okay. Okay, it's again Taqir Hussain. He's saying, ma'am, how to speed up reading in part A? Taqir, I've told you that it is all about practice. Reading part is a game of time management. You can easily score all the 20 corrected by your practice. And now, any other question? Can we get recordings of this webinar, please? Yes, Iman, you can. After a day, it will be on our YouTube channel. You can see from there. And Rani is saying, what is GMC? Rani, it is Journal Medical Council, and basically it is United Kingdom Medical Council. Okay. So, any other questions?
And as you told that previous webinars are you conducted before, so can I get the recording on your YouTube channels of the previous one?
Yes, yes, you can. Sure, you can search on the YouTube. You will get recordings of our all previous webinars.
Thank you.
Welcome. Okay, Rani, to everyone, thank you, ma'am Naisla. Thank you so much for all your appreciations. And Jazakillah. Okay, please, if you have any query, any question, please ask away. How many of you are... Hello?
How your free WhatsApp group is working?
Yes, exactly. I was going to talk about this because I was asking how many of you are a part of our WhatsApp group. It is very active group, and we conduct activities there daily from Monday to Friday at 3 p.m. GMT. So there are a number of students of mine. I'm seeing those participants which are our group member. So if you are not a part of our group, please join it. Ramesh, please copy the link of our group, and they can all join us. And on Monday, we conduct writing. And Tuesday, it is a listening day. Wednesday is our reading day. So we have divided modules according to the days. And it is a very healthy activity. A number of students participate there. And most of them get their letters corrected in 1 hour, because in 1 hour class it is not possible to give the detailed feedback of all the letters, but trust me, it is very beneficial. Most of students learn from that WhatsApp group. I think I have a student there, Vandana Dhama. Vandana, can you please open up your mic?
Yes, ma'am.
Okay, that's great, Vandana. Vandana, can you please tell her that how beneficial is that WhatsApp group for you,
Yeah,
on
it
which
is
we
very,
conduct our activities? Yeah,
yes,
yeah.
ma'am. It is very much beneficial for me because writing is 2 days, and listening and reading is also, and speaking is also very beneficial for all of us. And we are very keen to join with you in this WhatsApp group, ma'am. We
Okay, thank you
waiting
so much,
eagerly.
Vandana. Thank you for your words. Okay, there is another student named Dr. Gita. Dr. Gita, can you hear me? Okay, Dr. Khurram. Dr. Khurram, I think he's also our group member.
Yes, ma'am, I'm hearing.
Okay, that's
Dr.
wonderful,
Gita.
Gita. Yes,
Yes,
Dr.
ma'am.
Gita, please help other students that how beneficial is our WhatsApp group for you?
So much beneficial. I've improved myself, especially in writing, reading, and listening. Speaking, I have so much. Still, I'm still worried about speaking, but in 3 sessions, I'm improve myself in reading, listening, and
Okay,
writing.
that's wonderful, Gita. Thank you so much for your words.
Thank you, ma'am.
You're welcome. So, is there any other question?
Madam, I have question. Madam, I didn't attend any speaking session. How you conduct the speaking session?
Your name, please. Can I
Dr.
know your
Gita.
name? Okay, Dr. Gita. Dr. Gita,
Dr. Gita.
yeah. Okay. Dr. Gita, you have to take a mock with me or any mentor if you want. So it will be on Zoom, and role play cards will be shown to you, and you will be assessed for all of the speaking criteria that either you met all the speaking criteria or not.
Can I ask one question, please?
Yes, sure.
Just need to ask that what WhatsApp discussion group, this is the group which you are talking about? My name is
Yes.
Salma. I'm sorry, I forgot to introduce myself. My name is Salma Banu. Just need to ask about the WhatsApp group you are talking about, because I am new, and just yesterday night I read about which was posted in different. So right now I joined. Just need to ask that WhatsApp group which you have, it is in the chat box. Is this the same you are talking about?
Uh, One second, please. Let me see it. Yes, Ramesh has shared the link of our WhatsApp group. It is free WhatsApp group, and you can join it. And I must advise you to join it because it is very helpful for you. And number of students can tell you that how this group was beneficial for them, as we have divided the days according to modules, and all the four modules have been practiced here.
Okay, thank you so much. Thank you so much.
Welcome.
And the WhatsApp group, sorry, again, I want to, this is the name by OT discussion.
Yes, OET discussion.
Okay, now I joined it. Thank you so much.
Okay.
So as I understand that you have multiple mentors, so is it in my hand that which mentor I want to choose for my future if I want to take a course?
Yes, yes, it's totally up to you. You can choose by yourself.
So how may I know how many mentors and their style?
I have told you that you can search in on YouTube that what about our webinars and our course activities. You can get idea from there. And if you take our course, then you will be introduced to all the four mentors, and it will be totally up to you whether with which mentor you want to take your mock. You can tell the administration, and then you can get yourself registered.
Okay.
Okay, any other question? Okay, is Ramesh here? Ramesh, can you hear me?
Yes, Dr. Maryam, I can hear you.
Okay, Ramesh, now I want you to say some words for our WhatsApp group so that students may know the value of that group.
Yeah, Dr. Maryam, I have already shared the link in our chat box, and I recommend and encourage all students to join us because we conduct, Dr. Maryam is with us in this group, and she conduct daily activities there, and this group will be very beneficial for you. And we recommend all of you to just join, and our success rate and passing percentage of OET is very good, alhamdulillah, till now. And we would love to,
Okay, thank you. Thank you so much, Ramesh.
am I
Okay,
audible?
students. Yes, yes, you're audible.
Yeah, so I want all of you to join our WhatsApp group and create your success story of OET with Med Exam Expert, inshallah.
Inshallah.
Hi, Dr. Maryam. Just need to ask that you talk about that this is a webinar. Could you please tell me what is webinar? Because I'm just new in this group and I want to know something about it.
Okay,
Have to
okay,
get the
Dr.
OET as
Salma.
well.
It is just like today's session. The session which is conducted today, it is called webinar. So you can search on YouTube. We have a channel with the name of Med Exam Expert, and you can search all of the webinars of our OET course there. There are a number of webinars. You can easily search it on YouTube.
Yes, okay. Because we need the grade B in all four components. Yeah, okay, I will
Yes,
search
you
it.
should. Yes. Good luck.
Excuse me, what is the name of WhatsApp?
Still, I didn't complete it. Let's see.
Yes, yes, Rani, please. I think she is gone. Okay, any other query? Okay, I have seen in comment box that all the details have been given. So you can contact on this number for any guidance like live session, course details, each and everything will be provided to you by contacting on the number given. Thank you. Thank you so much, Ramesh, for your words. So is there any other question? If not, then I'm going to end this session. And thank you, all of you, for the maximum participation. And I hope you all will join our free WhatsApp group. And you will see a change in your preparation, that how helpful that WhatsApp group is. Because after every 2 weeks, whenever the OET result announced, we got a number of beautiful reviews from our students. And you can see all the reviews in our group as well. So I advise you all to please join it. It is for the sake of your benefit. And thank you so much for today's presence. Allah Hafiz.